Hello, everyone. My name is Randon Heim. I am a clinical psychology doctoral student at the Chicago School of Professional Psychology at Xavier University. And my project is about addressing COVID vaccine hesitancy in African Americans. Prior to the pandemic, we were well aware of a number of health disparities that were affecting the African American community, and the COVID-19 pandemic has only exacerbated several of these health disparities nationwide. Using CDC data and Johns Hopkins data, it was found that African Americans are 3 times as likely to be hospitalized, as well as 2 times as likely to die from the virus when compared to their white American counterparts. On the right here, you can see I have a racial breakdown of Louisiana residents who have died of COVID. You can see a big discrepancy here with African Americans accounting for 70% of the death statistics, of COVID-19. You can also see a number of underlying conditions that only increase the likelihood of having a severe reaction to COVID. Things like hypertension, diabetes, and obesity, and cardiac disease are more prevalent in the African American community already. So African Americans are more likely to be hesitant and show mistrust of medical vaccinations, and I'm going to get into that in the next slide. And I wanted to address this hesitancy using a clinically based solution because not only would this help to slow the spread of COVID-19 if we got more people vaccinated, but it would also reduce a number of these racial disparities that we're seeing in the African American community. Second is reasons and consequences of vaccine hesitancy. On the left, you can see a picture of the very notable and famous Tuskegee syphilis experiment, in which a population of the community of African Americans in Macon County, Alabama, were infected with syphilis under the facade of free healthcare, and they were denied treatment using penicillin for decades. So this is just one example of a historical mistreatments from government institutions. And this has only heightened the skepticism seen in the African American community. So again, this mistrust of various medical establishments is a main driver of the COVID-19 vaccine hesitancy. So in order to actually reduce these racial mortality gaps, we need an evidence-based intervention that will be implemented to increase vaccine uptake and of course, reduce these disparities that we're seeing. And that is where clinically based practices and solutions come in using motivational interviewing. So motivational interviewing has proven to be a well-supported and efficacious method of working to not only change the health attitudes, but the following behaviors of an individual who say is hesitant of vaccines in general. So I've created a small chart here using motivational interviewing steps and the descriptions of these steps. So we have collaborative and guiding style was the first one. And this is very important because it allows first the clinician to establish a rapport with their client, but also is characterized by neutrality, using open-ended questions, affirmations, reflections, and summaries. It's also very important because this style allows clinicians to use culturally centered methods. And these have been proven to be effective at addressing medical related distrust in general. Number two is exploring hesitancy with neutrality. This is also very important because it allows the client to not feel judged in their hesitancy for whatever reason. And the clinician can establish some sense of neutrality and emphasize the client's autonomy. And from there, you can slowly work to understand their reasons for hesitancy in general. And lastly, we have what is an exercise that could be implemented in practice, which is a decisional balance table. This strategy involves basically a simple version of weighing the pros and cons of a particular decision. And of course, in this case, whether or not to get vaccinated. Agency is really the main thing here because this is going to be placed on the client. And more often than not, research shows that a client will make a healthier decision going forward if they're able to balance out the pros and cons of a situation. Um, so all of this should be implemented, I feel, in clinically based practice in order to increase vaccine uptake in general. Here are my references. Thank you everyone for this opportunity. And yeah, have a good one.